specific services. So it is actually a way of providing care. It is not a checklist of what should be done. It's more of a way of taking care of people. And primary care is distinguished from secondary and tertiary care because of its duration, frequency, and the level of intensity in terms of the care that's being provided. Again, it is not a set of specific services, but rather how you actually take care of your patient holistically. And it focuses on the following: prevention, diagnosis, therapeutic services, health education, counseling, and sometimes even minor surgery or procedures. Now, secondary care, on the other hand, includes hospitalization, routine surgery, specialty consultation when you get a referral from your primary care provider to see, say, a cardiologist, and also rehabilitation. So rehab is considered secondary care. Um, Secondary care is usually short term. It involves intermittent or sporadic consultation from a specialist to provide expert opinions. It could also be surgical or other advanced interventions that primary care physicians are not equipped to perform, meaning they don't have the necessary equipment to do it in their office. Tertiary care is the most complex level of care for usually not very common conditions. And for the most part, because of the intensity and the complex level, it's usually done in an institution. So it's institution based. It's highly specialized and very technology driven. It could be a level of care given in a long-term care setting, like uh, recovering from trauma, burn treatment, NICU, or neonatal intensive care for prematurely born babies. Transplant recipients before they're discharged. And another example would be open heart surgery. Now let's talk about uh, choosing a primary care provider. So there are a number of providers who can provide primary care. Among physicians, you have family practitioners. So they can see both children and adults and even older adults, also known as the geriatric patients. Then you have the internists. They see adult patients and older adults. Then you have geriatricians. They are internists who undergo an additional 1 to 2 years of subspecialty fellowship in geriatrics. Most geriatricians are also trained in palliative care, which can be an additional fellowship training. Palliative care is a subspecialty that focuses on hospice care. The next type of physician would be pediatricians. So they see patients from a newborn up to 21 years of age. Then, of course, you also have the non-physician practitioners, like nurse practitioners. They can have their scope of practice as well, like adult or children. Then for women's health, you have certified nurse midwives for women's health and female reproductive issues. And then last but not the least are physician assistants. They are technically under the supervision of a physician, so your PCP on record may be that physician assistant's supervising physician. Um, it is important to do some legwork if you are choosing a PCP. And just to go back one slide, here are the questions that you should be asking yourself. So, is the office staff friendly? Are they helpful? Are the hours convenient to your schedule? Does it make it more accessible to you? Do you prefer a provider whose communication is friendly or more formal? Of course, they have to be professional on whatever level. Do you want someone who's focused on disease treatment or the one who treats you holistically? And would you prefer a provider that has a conservative or a more aggressive approach to treatment? Another thing you might want to look at is does your provider order a lot of tests? Do you get a lot of referrals to other subspecialists? You could go online and look at reviews for the physician. What do other people say about the physician? And do you feel like you're actually being invited by that provider to be part of your care? Meaning you're not just a patient, but you are a direct participant of the healthcare services that is being given to you. Now, the WHO, the World Health Organization, defines primary care um, in certain specific ways. And according to them, primary care should be essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology. And because it is the first level of contact and first element of a continuing healthcare process between a patient and the healthcare system, it should therefore be universally acceptable and universally accessible. And to achieve continuity of care, it should be affordable so that it can maintain health at every developmental stage, meaning a continuum of a patient's life. And it should also be physically easy to get to so that it can bring health care as close as possible to where people live and work. Now, the Institute of Medicine has some things to say about primary care, particularly with regards to its future. And what the IOM recommends is that in order to harness primary care's fullest benefits, it should first provide integrated, accessible healthcare services by clinicians who are accountable for addressing the majority of personal healthcare needs. Second, it should develop a sustained partnership with patients. And third, and these providers should practice in the context of family and community. That's the end of part 1 of lesson 3, primary care. There is going to be a link for this video, a separate link after this video lecture. So I want you all to watch that as well.